It's an antenatal session, and the chief nurse is teaching pregnant women how insecticide-treated mosquito bed nets can protect them and their unborn children from malaria. This is part of the national malaria prevention programs in Nigeria since rollback malaria was launched in 2005.
If you refuse to use it, it can kill that baby. At the same time, it can kill the mother.
The female Anopheles mosquito carries a parasite called protozoa that causes malaria, a preventable disease. Malaria is one of the highest killer diseases in Africa. The Federal Ministry of Health record shows that every year malaria kills 7,000 pregnant women and 300,000 children under the age of 5. Malaria control in Nigeria consists of two key areas: prompt diagnosis and treatment of cases, and multiple preventative measures, which include long-lasting insecticide-treated nets and indoor residual spray. However, in 2010, the Nigerian Institute of Medical Research carried out a study that confirmed that mosquitoes in Nigeria are resistant to insecticides.
The mosquito in the wild are also getting adapted to this insecticide, what we would refer to as insecticide. They become resistant to the insecticide. Now, if you want to study what are the mechanisms, what are the problems associated with the resistance, we need to understand the behavior of those mosquitoes. And we cannot eliminate malaria without deploying multiple prompt interventions.
The environment is also a critical challenge in the fight to control and eradicate malaria. Imagine what will become of this area when it rains.
It's actually about 3 feet deep. This gutter should be a free-flowing one, but obviously is stagnant by the refuse here. And this is a perfect spot for mosquitoes to lay their eggs. And this exposes the residents around here to constant mosquito bites and malaria infection. But they are not alone.
Even people like Rose, who live in a relatively clean environment, suffer from the consequences of blocked drainage. Earlier, she took her 5-month-old daughter to the clinic, where she was diagnosed with malaria.
When I was pregnant, I always use it with my husband. I have not gotten malaria for 1 day. So I always advise them to use it. It's very, very good for children. For some time, I've not been using it for this girl for over 1 month now. That's why we have this problem of malaria.
There is currently no vaccine against malaria. The recent development of a vaccine by US scientists may give Africa some measure of hope, but until it becomes publicly available, children under the age of 5 and pregnant women will remain at risk. The Nigerian Minister for Health had promised that the country will eradicate malaria by 2015. With just under 2 years to go and the huge problem of drainage channels in the country, environmentalists doubt the possibility. Vivienne, Irikefe, TVC News, Lagos.